Maxeke Academic Hospital will remain shut until it receives clearance from the City of Johannesburg. The facility was shut last month after a fire damaged several structures and more than 800 patients were evicted. The hospital was poised to open today, but hospital representatives say that this will not be happening. For more on the story, we cross live to our reporter Zikhona Tshona, who is following that for us. A very good afternoon to you, Zikhona. A bit of a disappointment and a bit of a wet blanket today as we're all waiting in anticipation for the reopening of the hospital. Give us some reasons as to why this delay.
It certainly left many patients frustrated. We arrived from as early as 6 o'clock this morning, and we saw many patients being turned away, security guards forced to redirect people to other health facilities or basically telling them to go home. When we arrived, we spoke to a gentleman who had brought his father to come and receive medication here, and he was told to go to Chris Hani Baragwanath Hospital. We also spoke to a woman who had traveled all the way from Polokwane to come here for an appointment that she was told was meant to be today, and then she had to drive back this morning because she was not able to be redirected to another health facility. Hospital management urging people to not come to the hospital but rather go to health facilities that are close to them, because the phasing in of the reopening of the hospital has not been able to get underway as previously announced. We know that the provincial government announced on Friday that it will be able to begin the phasing in of the reopening of the hospital from today, but people really saying that there hasn't been much communication to them. Management urging South Africans, or citizens rather, who are using this facility to continue making use of the hotline numbers to just inquire as to when they are able to come to the hospital for it to be operational. Now, we know that there has been a delay in as far as the opening of the hospital is concerned. The hospital saying that it's waiting for approval from the City of Johannesburg. Let's take a listen to the acting CEO of the hospital giving some detail as to why the reopening of this hospital was not able to get underway today.
Where we are as a hospital, we are ready to resume services, subject to one certificate of compliance from the fire at the City of Johannesburg. Immediately after the fire, the City of Johannesburg conducted a sample assessment of the facility. We then appointed a contractor to rectify or remedy the fire compliance issues. Subsequent to that, we invited them back into the institution last week Tuesday to go and do a full assessment in all the areas that we are allowed to occupy as per the structural report. They did that assessment and gave us a report on Tuesday. We then also continued remedying some of the issues that they've raised. We then agreed that they're going to come back on Friday to do the final assessment. They came on Friday and they did the final assessment. So as a hospital, we're waiting for the clearance from the City of Johannesburg.
So still waiting then for clearance from the City of Johannesburg. But Zikhona, if you could give us an idea of the bearings. A lot of people do use public transport to get to various hospitals, including the Charlotte Maxeke Hospital. For those who have made their way there today and have found that they cannot be assisted, what is the lay of the land as far as proximity to other hospitals that could perhaps be able to assist them?
And that's been a huge concern for many people because, as you know, normally our public hospitals are inundated in terms of numbers. A lot of people going to make use of them. So this morning we saw at least 2 buses bringing passengers to this area, and people coming out and then finding out that they are not able to make use of the facility. A lot of minibus taxis also carrying patients were turned away. So people are being redirected to facilities like I've mentioned, like Chris Hani Baragwanath Hospital, but also to clinics that may be closer to them. People have been raising the concern of the fact that they woke up early and traveled for hours to be here on time because they heard on the news that the hospital will be reopening today. But the hospital management reiterating and emphasizing that patients should not come to this facility as yet. While they do maintain that they are ready for operation, they have not been given clearance by the City of Johannesburg. So until that clearance is received, they will communicate to patients, and patients will be able to make use of the facility. But I want to emphasize that patients who do make use of Maxeke Hospital are advised to not come to the facility as yet until the hospital does communicate with them in as far as when the hospital will be able to open. We know that this is a specialized health facility, so a lot of cancer patients will be making use of this facility in particular. So they are advised to not come here. I just want to paint some context. The cars that we are seeing parked here, these are not necessarily cars belonging to patients. These are cars that are used by staff members of this facility. We know that the vaccine for COVID-19, a lot of the staff members would have come here for them to be vaccinated. So as far as patients are concerned, there is no help for patients that will be able to take place here at Maxeke Hospital. Management urging people to make use of the hotline, but also to just wait for communication in as far as when the hospital will be operating again.